We're at the conclusion of this hair restoration for this gentleman, about a minute out, and you've seen a lot of our videos talking about graft dissection, graft placement, recipient site creation. We're focused on one particular idea here. This gentleman has extensive hair loss from here to here, and this has all been transplanted. What we're focusing on today is what kind of recipient sites did we create and why? In the central density here, in the idea of the extended central forelock, which you may have remembered from another video, if not, you can review that idea, which is to create maximal density from the center here all the way back toward the crown. That central corridor, or extended central forelock, is a prime focus of density. What we've done is done very tiny little punches, little round punches that are 1.2 millimeters. And the benefit of doing this is it takes the bald scalp out and puts in new hair. Now, why is that so important? Well, think about this. If you have an area of extensive hair loss and there's a lot of naked scalp there, and you put in hair with more scalp, you give them more surface area for bald scalp with the hair. But what we're doing is we're almost doing a one-to-one exchange of scalp for scalp, so he's not increasing any bald scalp. In fact, sometimes there's actually a little bit more core removed, so there's actually a total gross reduction in bald scalp area. At the same time, we're putting hair in. So to me, that's a wonderful thing when we have a gentleman that's a good candidate for this. And what we've done is we've done and carried that concept all the way forward, almost to the hairline. When you're at the hairline, you don't want to do that. We use a very, very small slit sites, sagittal slit sites. But as we go back about a couple centimeters backwards, these are micro punches that are 0.75 millimeters. So you can imagine extremely, extremely tiny. But again, being able to do almost a one-to-one, if not a little bit more favorable than one-to-one exchange of bald scalp. And then staging that back, going into a 1 millimeter punch graft removal of bald scalp, and then going back into the central density corridor of 1.2 millimeters. So what's great about this little video is trying to have you understand that we're so focused on just placing hair into bald scalp. What we don't understand, or I don't think has been conveyed well enough, is oftentimes the problem of basically just adding more bald scalp to the area, but we've done a good exchange of removing bald scalp at the same time putting scalp that comes naturally with each hair graft. And hopefully that idea is clear to you guys, but I think it's a profound concept, especially for a gentleman that needs an extensive recreation of hair, so that we don't actually add more baldness to him, but actually take that away.